So heart valves are like doors between atria and ventricles and between ventricles and large arteries. And the job of a heart valve is to make sure that blood is only going in one direction. Blood never flows backwards in the heart. It always keeps moving in one direction. So in reality, a heart valve is going to be found anywhere in the heart to prevent the backflow of blood into one of the chambers. Okay, so it's just preventing the backflow. And again, think of it, I always think of these as like a one-way door. Okay, it can open in one direction, but if you push it the other way, it's going to slam shut. So we have valves between the atria and ventricles. We call these the atrioventricular valves, sometimes AV valves for short. And then we also have what are called semilunar valves. And these are between ventricles and large arteries. Okay, so let's start with the atrioventricular valves. I typically will call these the right AV valve and the left AV valve. I think it just makes life a little easier. Let's go back to this picture. So the right AV valve is here, okay, between the right atrium and the right ventricle. So between the right atrium and right ventricle is our right AV valve. Between the left atrium and left ventricle is the left AV valve. Okay, so I like to name them that way. I just think it makes sense. It makes it really easy. It's consistent. However, they also are given other names. So this right AV valve over here, we can also call this the tricuspid valve. So you can see that here, tricuspid valve. And part of the reasoning for that name, let me erase that. Notice down here, these chordae tendineae coming down from the valve. Notice there's 3 papillary muscles. So tricuspid means there's 3 flaps there, 3 papillary muscles coming up. So tri means 3. The left AV valve, we can also call it the bicuspid valve. And again, this one gets its name, bi means 2. So if you look at those chordae tendineae coming down, and notice there are those 2 papillary muscles. So the bicuspid valve has sort of 2 flaps or 2 cusps. So we have a tricuspid valve on the right, bicuspid valve on the left. We can also call this bicuspid valve the mitral valve. Okay, so it's another term for it. And sometimes this gets used in medical conditions like mitral valve prolapse. It doesn't matter to me what you want to remember. If you want to remember tricuspid and bicuspid, if you want to remember right AV valve, left AV valve, if you want to remember this one over here as the mitral valve, it doesn't matter. They just have lots of interchangeable names, okay? Now, again, these valves, the AV valves is what I will call them throughout the lecture. These, again, they're located between the atria and ventricles, and their job is to prevent the backflow of blood from the ventricle back up into the atrium. Because if we think of the way blood is moving through the heart, it comes into the atria. From there, it moves down to the ventricles, and the ventricles pump the blood out of the heart, either to the lungs or to the body. So the last thing we want is blood moving backwards. That would be very inefficient, and your heart would have to work a lot harder. If we look at this image of, now in this case, we're looking over here, we're looking at the left AV valve, okay? And they've blown it up really big and added color to it here. So you can actually see the valve. You can see the chordae tendineae connected to those papillary muscles. And those are what are going to help that valve open and close. And so when blood is moving from the left atrium down into the left ventricle, you can see that the AV valve is open. But as soon as the left ventricle fills up, which you can see down here, that left AV valve is going to snap shut. And the reason is we do not want blood to move backwards, back up into that left atrium. Okay, so again, think of a door. Now, this is an image that you can see here. This is showing you through a camera, you can see into someone's ventricle and you're able to see things like these chordae tendineae coming down from the valve. You can see the papillary muscles that they're connected to. So that's pretty cool. And over here on the right side, this is obviously a preserved specimen, but we can see the same thing. So we can see these valves, okay? And then we can also see those chordae tendineae, those strings. And you can even see the papillary muscle. Now this is actually a frontal cut through the heart. So the one over here on the right. And again, we have our right ventricle is over here. And our left ventricle is over here. Now, the other valves that we have are the valves that are going to prevent backflow into the ventricles. Okay, so the atrioventricular valves are preventing backflow into the atria. So now we have to have a way to prevent the blood from flowing back up into the ventricles. And so these are called semilunar valves. These are between the ventricles and those large arteries that they're pumping the blood out of. So we have an aortic semilunar valve that we'll find between the left ventricle and the aorta, and a pulmonary semilunar valve that we'll find between the right ventricle and the pulmonary artery. And again, these are preventing backflow into the ventricles. And so in this case, these look a little different than our AV valves. Semilunar valves don't have chordae tendineae. They're not connected to papillary muscles. Instead, they get their name because semi means half and lunar means moon. So they almost look like these half moon structures that you can see here. So in this case, we're looking right here. Again, remember, this is our right atrium, right ventricle. And so this would be pumping out into the pulmonary artery. So this is our pulmonary semilunar valve, and they've just blown it up and added color here. So you can see that semilunar valve here looks like a half moon, and it's open, and it is allowing the blood to leave the right ventricle and go out into the pulmonary artery. But as soon as the ventricle has squeezed out all the blood, as the ventricle is relaxing back out, what you don't want is for blood to be able to flow backwards into the ventricle. So this pulmonary semilunar valve snaps shut, and that is going to keep the blood from flowing backwards into that right ventricle. And we have the same thing between the left ventricle and the aorta. So let's talk a little bit about some disorders that affect the heart valves. There are two conditions that can really weaken the heart. One is something called an incompetent valve. So this is when the valve doesn't shut all the way and blood is able to flow backwards into either the atria or the ventricle. And what happens is the heart ends up having to pump the same blood over and over again, and it makes it work a lot harder. The heart's working harder to move the same amount of blood. I always think of this as sort of like when you open a door, if it stays open, especially if it's an outside door, you're losing air conditioning, it's moving back and forth, your air conditioner has to work harder. So that's sort of like an incompetent valve that just stays open, blood's moving back. Valvular stenosis is when the flap of the valve gets stiffer. So when a valve stiffens up, it's not able to open and close as well. So it's really going to restrict the opening of that valve. So the heart has to work harder to get the blood through the door. So think of it as like when you open your door, but you open it just a little bit, you kind of got to squeeze through. That's valvular stenosis. So these conditions can be fixed with a valve replacement. So for valve replacements, they can use a cadaver valve. They can use an animal valve. Usually it's a pig valve, or they can even use a mechanical valve. So let me show you a mechanical valve. So here is a mechanical valve. This is just an example of one. And so you can see this would be one that would get placed in between the ventricle and a large artery. So between the right ventricle and pulmonary artery, or left ventricle and aorta. And so you can see that if the blood were getting squeezed out of the ventricle, you can see that little ball raises, and now there's an opening and the blood can come out. And then when the ventricle relaxes, you can see that ball falls back into place and the blood cannot come in. It cannot pass around that. Okay. Now, obviously, the problem with this is that it's loud. So I don't know if you can hear this. I'll kind of hold it up to my microphone. So every time, and I can shake it. Hear it. Every time that blood is moving out, so every time this valve is opening and closing, you don't hear it when it opens, right? You don't hear anything when it opens. It's quiet. But when it closes and it falls back into place, it makes a noise. So people who have a valve like this, they end up ticking. Like you can hear them, you can hear their heart ticking.